welcome to the Manual Handling Advisory Service. My name is Nesta. I'm the Manual Handling Services Lead for Buckinghamshire. Today's practical tutorial is on the 3 emergency techniques that we use within the organization to reduce the harm to patients and staff if someone falls. The 3 techniques are: 1, walking and falling; 2, independently standing from the floor; and 3, chair to floor. Please be mindful to consider your personal health and well-being before carrying out any of these techniques that we are about to show you. Walking and falling. Why do we show this technique? It is because sometimes a patient will lose stability and their legs will not support them. In this case, you will need to know how to safely and effectively lower the patient onto the floor. This is how we do it. You must consider 2 things. Does the patient have a history of falls or unsteadiness? The height and weight of you and the patient. Please note, this is not catching someone, as this can badly injure you and make the situation worse. This is our second technique, that is independently standing from the floor. That means the patient is going to stand up independently using commands. If a person has fallen, this is how to get the patient up from the floor independently. First, assess: is the patient injured? If the patient is injured, then you will need further assistance. For the purpose of this training, we are going to assume that the patient has fallen with no injury. Take your time. There is no need to rush. Think about the environment you are currently in. Are you and the patient safe from further harm? Again, we are going to assume there is no immediate danger. If you can't get somebody up with verbal prompting, then you may need to consider alternative devices, such as a hoist or a scoop. These are available around 3 main trust hospital sites. Again, we are going to assume the patient can understand and follow the instructions. Now, you need to ask your patient, how are you feeling? Do your usual checks. Have you banged your head? Once all these checks have been made and it's deemed safe for you to get the patient up, use the following technique. Are you able to turn onto your side for me? With your left arm and your right hand flat onto the floor, can you bend your knees up? Are you able to push yourself up slightly? Are you able to come onto all fours? At this point, you will need a chair. Find one that is stable. Okay, can you put your hands onto the chair and bend your strongest leg up for me? At this point, you may find it difficult to get the patient up from the floor. Turn around and sit down. Introducing a second chair can assist with this. So, can you slide yourself back onto the chair, Becky? Alternatively, you can put up or get the patient to go between 2 chairs and choose the strongest side to slide onto. Our third and last emergency technique is to assist a person from the chair to the floor. In this next technique, we are going to demonstrate how to assist or move a patient from chair to the floor in the event of an emergency. We are going to demonstrate this technique twice. The first time, we are going to do it in slow motion so that you can understand the technique, and the second time, we will do it in real time. So check, is the person on the commode, on a lightweight chair, or the chair that has no arms? That means a second person will be needed to do this technique. Secondly, ensure the brakes are locked on wheelchair before starting. Do not pull on their clothing. Do not physically lift the patient from the chair onto the bed. Be rest assured of your surroundings. In this type of an emergency, what now you need to do is kneel on the side of the patient where the patient's head will be. Place the nearest arm across the body. A patient will be slammed in the chair. Get the patient's upper body in a half row. Place your hand on their hip and on their lower thigh and push. If this does not bring the patient onto the floor, you then grab the furthest hip and bring them towards you. Once the patient is on the floor, you are going to support their upper body and bring it towards you. Kneel backwards, supporting their head down onto the floor. Put the inner arm towards the edge or opposite side, then push from the mid-thigh and the hip, and then reaching for the furthest hip from you, you can just support the head, bringing the patient down.